Okay, let's talk general survey. You're going to learn as an experienced nurse that every time you walk into a patient's room, you're doing your environmental scan, and we talked about the 7 factors that you're looking for in the environment to make sure it's safe and comfortable for your patient in a previous video. And the other thing you're doing is you're looking at your patient with intention. So you're really using your observational skills, and you're observing for kind of like 4 main areas. So the physical appearance of the patient, and we'll talk about the components that are part of the physical assessment that you have a quick look at. You're looking at the body structure of your patient. We'll talk about the components of that you observe for. We look at your patient's kind of overall mobility, and we look at the behavior. And so we'll talk about each of the factors within those 4 areas that you're just observing. General survey is more observational than examination, and your general survey will often help you identify factors that need to be assessed further. So before you walk into your patient's room, of course, you're going to do your hand hygiene. I'm just going to walk through the initial steps of introducing myself to my patient before we walk through the general survey. Good morning, Miss Jones. My name is Linda. How are you?
Good morning. I'm good. How are you?
Good, good. So I'm the RN who will be working with you this morning. You're kind of quite flat there.
Yeah,
Do you want
pretty uncomfortable.
Yeah, how about we raise the head of the bed?
Oh, that would be great.
So, guys, when we talk about kind of body structure, one of the things we talk about is position. And oftentimes, as a novice learner, you don't really see the position of your patient, but you can see right away, I noticed from her position that she kind of looked a little bit uncomfortable. Of course, I'm going to do her name check, so she would normally have an identifier band on. I would compare. Can you tell me your first and last name?
Sure, it's Rebecca Jones.
And can you tell me your date of birth?
December 28th.
And what year?
1991.
Okay, perfect.
Thank you.
So you as novice learners want to start kind of saying these pieces out loud. Me, as an experienced nurse, I'm doing these automatically. So when I'm looking at my patient in terms of physical appearance, so number 1, I'm looking at her age. So does she appear to be her stated age? Some people can look younger than their stated age. Some people can look older than their stated age. Older, you start to think about, have they been suffering from chronic illness? Do they have grief? So you're starting to look for some of the things that might contribute to that. We look at gender. So making sure that you do not assume gender. So based on appearance, Miss Jones appears to be female, but she could be AFAB, so assigned female at birth, but she could also be AMAB, assigned male at birth. So always being aware and checking with your patient in terms of how they want to be called. Some of the other things we're looking for in terms of physical appearance, level of consciousness. So Miss Jones, she looks alert, awake. I asked her some names to verify who she was. If there's anything that might indicate she's not entirely sure of, like if she had given me the wrong birth date or the wrong name, I can ask 3 just kind of orientation questions. So she did know who she was. She did know the date. So we're orientating her to person, place, and time. She's orientated to person. She's orientated to time. I can ask her, does she know where she's at? Can you tell me where you are?
Yeah, I think I'm in the hospital.
So hospital is very general. Anyone can kind of look at their environment, a confused person, and still know that they're in a hospital. So can you tell me what hospital you're in?
Yeah, it's the Cape Breton Regional Hospital.
Okay, perfect. Sorry, time, we would ask, can you tell me today's date?
I think it's April 26th.
Okay, and do you know the year?
Oh, 2023.
Perfect. Sometimes it's okay if they get the, if she had said the 25th, sometimes that happens when you're in the hospital a lot, but it really lets you know, okay, they're orientated to time. So those are just some quick things that you can do if you're at all worried about level of consciousness. What else do we look for in physical appearance? So we look at skin color. So you're really looking to see that, and you'll learn how to do a skin assessment, integumentary skin system assessment quite in depth later on. But you're just kind of generally looking at your patient's skin. So does the color match their ethnicity? So we do have a white female. So you can kind of see, they kind of have like that pink kind of undertones. I don't see any, excessively red areas. She doesn't seem to be excessively pale. She's got some nice flush color to her face. So having a look at skin color, kind of letting you know the respiratory status, cardiovascular status can indicate that those are healthy. Just kind of having a quick look, making sure there's no open areas. So facial features. Again, you're going to learn how to do a more in-depth facial assessment, but you're really just looking for, does she have symmetry? You can see like she smiles easily, she maintains eye contact, she's nodding her head, so she appears to be comfortable with me in her space. And the other big thing you're looking for is any signs of distress. So, for example, perhaps the patient is in pain. So what are some things you might see if your patient is in pain? So could you give me an example, Miss Jones? If you were in pain, how would you express that?
Probably, oh.
Right? So looking for signs of distress. Are they crying? Do they flat affect? Are they, having difficulty breathing? Mm-hmm. And recognizing signs of distress are something that you want to kind of take care right away. So I know this seems like a lot, and it does kind of all happen simultaneously as you become more experienced, but you kind of want to walk through, okay, so physical appearance, these are the things that I'm looking for to assess my patient's physical appearance. And it's very observational. There's usually very little conversation happening with the patient. So then you look at the patient's body structure, so kind of from head to toe. So you're looking for, do they have all of their body parts? 2 arms, 2 legs, they have all of their facial features. It's hard to kind of figure out height and weight in the bed, so it's just kind of a quick, does their weight seem to match their height? Are they excessively tall, excessively long, short? Weight, you're looking for, kind of within that expected weight range, not emaciated, like really quite thin, but not overly obese either. They can contribute to different types of health deficits. Symmetry. So does one side of the body match the other side? So, you'll see that her hands, equal length, both sides. You look at her facial features, like symmetry in terms of her face, and then her trunk, her legs, her feet. So you're looking for body symmetry, making sure that one side is symmetrical. Are they missing a limb? Do they have an amputation? Posture. So posture and position are different. So posture is your vertical plumb line. So posture is ear over shoulder, over elbow, shoulder over hip, over knees, and over ankles. And posture is really hard to measure when your patient is laying down. So oftentimes when you get your patient in a sitting position, you're looking for those plumb lines. When they're standing, you're looking for that S curve and the alignment of ear over shoulder, over hips, over knees, over ankles. Position is different than posture. So position is where your body is when you're laying, when you're sitting, when you're standing. So we're looking at her position in the bed. Is she centered in the bed? Is she at the top of the bed? Is she comfortable? So you can see here, that position looks very uncomfortable. So one of your interventions, of course, would be, oh, Mrs. Jones, I see that you're kind of off to the side here. Can I give you a hand here in the center of the bed? So looking for position, whether they're lying, sitting, or standing. So body contour or body build, and so these are kind of the expected proportions for arm span. And again, like, you don't ask your patient to do these things. Like, you're just kind of looking. Symmetry will tell you something, does her body build kind of look within, you know, expected range for a female of her height and weight. Mobility. Again, it's just general mobility. You're going to learn how to do a full musculoskeletal assessment, but when I'm doing my general survey, I'm looking to see how easily does my patient move about. How does she move about in the bed? Can she get herself up to the top of the bed? Can she reposition herself? Can she get herself to the side of the bed? Right? So I'm looking at her mobility. Is she able to get herself into a standing position? Can she get from the bed? Can she walk easily to the washroom? So you're just kind of assessing their overall mobility. And of course, if you notice any deficits, then you go ahead and you do a more in-depth assessment. Gait, of course, is how they walk, and you won't always observe that when you walk first thing in the room, but as your patient gets up and about, and if they can walk, you would observe gait. Now, last but not least, also part of mobility is just kind of the range of motion. So yes, she can mobilize in the bed, but can she bend her elbows, bend her hands? Can she rotate? Like, can she move her joints easily? You'll learn how to do a more in-depth assessment for that. And then behavior. So behavior, you're looking for, so does her facial expression match the situation? So if she's not in any pain and she's comfortable, she's, you know, conversing with me, maintaining eye contact. But if she's just been diagnosed with a very difficult diagnosis, then I'm not expecting her to be smiling and laughing, and you know, so making sure that facial expressions, just because your patient is sad or frustrated, that may very well match their situation. So mood and affect. So ideally, you know, it's nice when your patients are, you know, they're kind of pleasant and, you know, engaging and cooperative. But again, if you've just been diagnosed with a really difficult diagnosis, is it okay if your patient's mood is sad or frustrated or even angry? Speech. When I talk to my patient and introduce myself and ask her how she's going, I'm looking at her speech. Is it garbled? Is it at a fast rate? Can I understand what she's saying? Does she make sense? So kind of a normal, even tone, not too loud, not too soft. Dress, you're looking for, does her dress match the situation? You can see that she's wearing a hospital gown. Does her clothing fit? Is it clean? And then personal hygiene. So her hair is kind of quite nice. You can see she's wearing her makeup. You can tell that her teeth are brushed. You can see, you know, she's got her nails done. So just kind of overall hygiene, personal cleanliness. So it's taken me how many minutes to kind of walk you through a general survey. And like I say, you will get to the point where this is just automatic and you just intuitively notice it. But as you're first learning, you kind of want to walk through those 4 areas, talk them out with your partner. Okay, so I'm looking at my patient's physical appearance. We talked about those factors: age, level of consciousness. We talked about body structure. We talked about overall mobility, and we talked about personal hygiene. Again, oftentimes in this observation, you might identify an unexpected finding that you would then go and do a more intentional examination. I hope this helps.